My name is Phil Anderson. I live in Pocatello, retired from the Idaho National Laboratory about 18 years ago. I continued to jog quite a bit through my 60s and very early 70s. My knees started to hurt. I was referred to an orthopedic surgeon who took x-rays, examined it, and bone on bone was the terminology I heard, and that I could either have some injections that would alleviate the pain temporarily. There was replacement surgery, which is most common, and I know it is effective, even though the recovery process could be miserable. At my age, I wanted to avoid surgery, and my orthopedic surgeon did say, well, regenerative technology also is a possibility. So I did some searching on the internet, attended a couple of seminars on stem cells, and even though I was largely skeptical, especially since my medical insurance coverage absolutely wouldn't touch it, but after meeting with Dr. Warwick, I was confident enough that I thought I should try it. The injections were absolutely painless, and within a day, I have not since had any pain in my knees. Not just only a little bit, but gone. Now, 3 months later, I'm functioning essentially normal, and compared to where I was, I'm feeling so well that I really don't want to push it, take a chance. I just want to keep it this way, but I am entirely satisfied, pleasantly surprised, and no complaints whatsoever. Thank you for the opportunity to share.
My name's Glenn. Had my left shoulder was bothering me, had given me some fits while I was working and stuff, and so I came in here, and Dr. Wyrick took care of me, gave me an injection, and took a couple weeks, and the pain is gone completely. It's awesome.
All right, so Benny, how long has it been?
Been 1 year.
1 year. How's the shoulder doing now?
Great.
Hey?
Yep.
That's awesome.
Yeah, I am happy.
So, if you're happy, then why are you back?
For a booster,
Okay.
which I didn't know. You just recently started offering yourself, so I thought, well, the first one the stem cell went so well, why not go a booster?
Right.
And then kind of put it half of it into the other shoulder because it was doing a lot of the work while the other one was recuperating from the stem cell.
Awesome.
Yeah.
So it's been a year.
It's been a year.
How much work did you miss?
None.
That's awesome.
Yeah.
I appreciate it, Benny. Thank you.
You're welcome.
Hi, my name is Dr. Brady Wyrick, and in this video, I'm going to share with you how to avoid joint replacement surgery without doing drugs, without surgery. We're happy to share this information because when it comes down to those osteoarthritic bone-on-bone joints, you do have a choice, and over the next few minutes, I'm going to share with you one of those choices. Now, I have two goals for this video. Number one is for those who are curious, who are wanting to get more information. That's why we have this video available for you. I'm going to share with you what we've learned over the last 2 years of doing these regenerative medicine procedures. And number two, for those of you who are ready to move forward, we are going to give you an opportunity to set up a consultation with us so that we can sit down one-on-one and talk about whether or not this is a right fit for you. Now, I do want to cover a couple of disclaimers before we move forward. Number one, regenerative medicine is not FDA approved. It is FDA cleared, it is FDA regulated, but the FDA has not approved regenerative medicine, so I can't stand here and tell you that it's going to treat anything. I can just share with you what we've learned, and you can make a choice from what you want to do from there. The second thing is that regenerative medicine is not covered by insurance or by Medicare because it is not FDA approved. Your third-party payers are not going to cover it. We will talk about cost in this video, but actual cost will depend on your individual case. That's why I'm highly, highly encouraging you to set up a consultation so we can just sit down and talk. Third thing is that all of the procedures that we do in this office are performed by our medical staff. Our medical staff, in my opinion, is second to none, especially here in Southeast Idaho. No one has more experience doing these types of procedures than our staff does. I'm very, very proud of them, and our success in this office has everything to do with their skill sets. Last but not least is number 4, and that is no babies are ever harmed in any of our procedures. There's a common misnomer, a common error in people's thinking that stem cell therapy equals dead babies, embryonic tissue, aborted tissue. It's just not true. These cells are coming from donated umbilical cords, so healthy mothers consent to donate birthing tissue that otherwise would have been thrown away. They donate that tissue to FDA-regulated labs, the highest quality FDA-regulated labs, and we get the cells and the tissue that we use from those particular labs for our treatment purposes. So those are the 4 disclaimers. With that said, I'd like to get into a little bit about my background. I've been practicing here in Idaho Falls for 13 years. 11 of those years we practiced functional neurology and functional medicine, which means this. Yes, I'm a licensed chiropractor. Yes, I'm board certified in chiropractic neurology. My focus for the first 11 years of my practice was to help people overcome chronic disease by changing the way they eat and doing very specific exercises for their nerves to make their nervous systems stronger. About 1.5 years ago is when we made the change into regenerative medicine, because it was actually about 3 years ago that I started seeing all this information, all this data, all this research that was saying, hey, this is where medicine is going. This is the future of medicine. Stem cell therapy, in my opinion, is the most important discovery in medicine since penicillin. And when I started reading some of the things that were happening, I was not okay with what I was doing anymore. I had to move forward because I knew this was going to be the future. We've done these procedures over 250 times here in this office. Again, I think our medical staff is second to none. They have the most experience. And I'm here to share with you in this video what we've learned through those particular procedures. Now, what I typically do, if you come to one of my live events or if you come to one of my webinars, I will spend a few minutes of time talking about some of the success stories we've seen. I put a few of them in the video beforehand. I'm not going to take much time to do that today. You can see the testimonials for yourself at our website. Is at iamregen.com/testimonials. It will take you the videos that people voluntarily do for us so that they can see, so that they can share their message with the world about how they were able to be helped. I am going to tell you the one story that is about my dad. I think he was the one. Well, I know he was the one that changed it all for me, because for the first 11 years of my practice, I saw his health absolutely nosediving, and I could not get him to do anything I asked him to do until it came to stem cell therapy. And on the day of Dad's injection, he was scheduled to have both of his knees replaced. They were bone-on-bone knees, and he was told the only option he had was to get total knee replacements on both knees. We injected his knees. He was one of the very few patients that actually feels better getting off of the table after his injection. And I'm happy to report that almost 2 years later, he still has not had to have knee replacement surgery. He's still doing very, very well. And he's actually back to riding his bike again. And just a couple weeks before we made this video, he was in Sun Valley where he rode his bicycle for 26 miles. So for a 72-year-old guy, I'm pretty proud of him. That's been one of my favorite success stories. But again, you can see the other success stories at my website, iamregen.com/testimonials. Okay, let's get into the meat and potatoes of this video. There are very specific questions that I know you have that I want to answer for you. Number one is I want to answer that question, what is regenerative medicine? The dictionary definition, or the Wikipedia definition, is regenerative medicine is a branch of translational medicine that deals specifically with the regeneration and growth of key cartilage and tissue. Now, for our definition here in our office, we utilize what's known as PRP, or platelet-rich plasma, umbilical cord-derived stem cells, and stem cell exosomes instead of using drugs and surgery. So our goal is to take a joint, like you see here on the screen. The joint on the right is what you might look like. The joint on the left is the only answer if you stay within what the medical world will tell you to do, which is drugs, therapy, surgery. We want to help you avoid becoming that knee on the right so you can regrow and regenerate that key cartilage, even in bone-on-bone cases, so that you can avoid looking like the knee on the left. That is regenerative medicine. Now, what about these other things? We're also going to answer for you in this video, what is PRP? What is platelet-rich plasma? What is a stem cell? What is a stem cell exosome? Who can regenerative medicine help? And is regenerative medicine right for you? So let's get started. Number one, what is PRP? Again, it stands for platelet-rich plasma. This is a process where we take your body's own blood. So our phlebotomist will draw the blood from your veins, and we will take that blood and put it into a centrifuge. And we're going to spin it at about 3,500 RPMs for about 5 minutes. And when that what happens is all of the solid material, like the red blood cells, are going to sink down to the bottom, and they're going to leave the plasma up on top. Well, that plasma has a lot of platelets in it. Those platelets contain cytokines, growth factors, the building blocks, and the messenger signals that your body needs to stimulate its own reparative response. Okay, so those growth factors and those cytokines, they can help guide your own stem cells, or they can take the stem cells that you get from a donor and guide them as well to start regrowing that key cartilage. PRP is a great standalone therapy, but it has its limitations. Okay, it is the least expensive option, but if you're over 50, it may not work for you because it doesn't have any donated stem cells. It's relying on your own stem cells. So that's PRP. We have found PRP to be an excellent add-on to doing stem cell therapy, or sometimes it's just great as a standalone therapy, just depending on each individual case. So that takes us to the next question. What is a stem cell? A stem cell is your body's own natural reparative mechanism. Right now, in all of the tissue that you have a store of these stem cells. You were born with them. Hey, these stem cells are blank slate cells, meaning if they're a blank slate, they can literally become anything. So these blank slate cells are held in reserve for you until you get injured. And when you get injured, these stem cells are released to go to the site of injury, start knocking the inflammation down, regenerating tissue, and help you to regrow and regenerate that new cartilage. Hey, this particular chart was an absolute game changer for me because this is what made it make all the sense. Up at the top of the chart, you can see mesenchymal stem cell. Down at the bottom of the chart, you can see a list of tissue that stem cell may be able to become. Okay, so on that list, we have bone, cartilage, muscle, bone marrow, tendon, ligament, adipose tissue, connective tissue, etc. Now, when you get injured in a muscle, these stem cells are released to go help heal the injury, but also to become new muscle. Hey, when you get injured in the bone, these stem cells can become new bone. When you get injured in the tendon, you see where I'm going with this. If you get injured in your thumb, these stem cells can become a new thumb. Now, there are three main things that a stem cell can do. Number one is when they're released, they're highly anti-inflammatory, and I suggest that you write these things down. Number two, they help modulate or control your immune system. And then number three, they start regenerating and regrowing new tissue. These three things are going to become very, very important here very soon. So a stem cell is your body's natural reparative mechanism. They're released as a reaction to injury. They are anti-inflammatory, they modulate your immune system, and they regenerate and regrow new tissue. Now you're probably asking yourself, if you have this awesome natural reparative mechanism already built into you, then why is it not working? And the reason for that has a lot to do with your age. As we age, the number of stem cells that we have decreases rapidly. When we are born, about 1 out of every 10,000 cells inside of our bone marrow is a stem cell. And as we age, that number drastically drops off. By the time you hit the age of 80, that number is 1 out of every 2 million cells is a stem cell. So as you get older, you have less stem cells available to help you to heal. On top of that, if you have some sort of stressful event in your life, those stem cell reserves can be used up, and that's going to lead to having less stem cells in your reserve so that you can heal. So it has to do with your age, but it's not just about quantity of stem cells, it's also about quality of stem cells. Because as we age, the robustness, as the papers say, the robustness of these stem cells decreases as well. Their ability to replicate decreases rapidly. Just for an example, a newborn baby's stem cells replicates every 28 hours. Meaning if you take one stem cell and leave it for 30 days, it'll replicate and double every 28 hours, and it will become 1 billion stem cells. Versus at the age of 60, our replication rate drops all the way down to drops all the way down to 60 hours, meaning at the end of 30 days, you only get 200 cells. So it's not just about quantity, but it's also about quality, and that's why your own natural reparative mechanism slows down as you age. So what we're talking about today is the ability to go back and to augment that system with new stem cells that will help regenerate, regrow new tissue faster. So next question then, what is a stem cell exosome? Now remember back, we talked about the three things that a stem cell does. Number one, they're anti-inflammatory. Number two, they control and modulate your immune system. And number three, they regenerate and regrow new tissue. Now we have known that stem cells do this because of something called an exosome. An exosome are the chemical secretions released by a stem cell that have what's called a paracrine effect on other tissue. Okay, these paracrine effects are modulated by what's called mRNA, or messenger RNA, that's released by the stem cell that will go to a dead and dying cell that is an information packet to tell that cell how to respond and what to do. So these paracrine actions are because of the stem cell exosomes, and what we now have the ability to do is to isolate those exosomes and use those therapeutically, which has opened up a whole new world to us. So if you look at this in terms of generations, hey, 10 years ago when we were doing first generation biologics, what we were doing is we were taking bone marrow from the patient's hip, we were taking that bone marrow, isolating their own stem cells, and injecting them back into people. This worked pretty well, but the problem is, as you age, the stem cells that they harvest are closer to cell death, and their effectiveness drops off due to age. So using your own stem cells in first generation biologics may not be as effective depending on how old you are. You get into second generation biologics. What happened was the FDA came along and said, okay, we can see what you're doing. We're going to clear you to use second generation biologics, which is allogenic stem cells or stem cells from a donor, and in this case, umbilical cords. Okay? The effectiveness went up because now we're using stem cells that can replicate faster, they don't die off as quickly, and they have longer life cycles. Now we're into third generation biologics where we have the ability to use these tiny exosomes that can get into various places of your body. For example, they're so small that they can cross the blood-brain barrier and have a dramatic influence on inflammatory conditions in the brain. They can get through the lung-blood barrier, get past the lungs, and go to other places of your body where they will seek out and find those inflammatory reactions. And they've opened up all new possibility for us when it comes to what conditions that we can help with. So what conditions can we help with? Our number one thing that we've been helping people with is osteoarthritic joints, especially bone-on-bone joints. Okay? Knees, hips, shoulders, these are all encapsulated joints that stem cell therapy has been shown to improve cartilage, or to improve pain outcomes and decrease and increase cartilage and help regrow, regenerate new cartilage. So how does that work? Okay, so if you look at this X-ray, on the right side of this picture, or on the left side of this picture, this is a 54-year-old male that walked into one of my colleagues' offices. On the left side of this picture, you can see a bone-on-bone knee. That knee, there's 2.8 millimeters separating the top part of the knee from the bottom part of the knee. The middle picture was taken 4 weeks after a stem cell injection, and you can see that space has gone to 5.3 millimeters, meaning that space is increasing because those cells that were injected into the knee are doubling and replicating and growing new cartilage. And then on the last picture, which was taken 8 weeks after the injection, the space has gone all the way to 6.1 millimeters, meaning that space is more than doubled in less than 8 weeks. Not only is that knee on the right side of your screen have less pain, but it's also more mobile than the knee on the left side of the screen. Mobile knees are happy knees. Mobile knees are feeding the brain with information. This individual at 54 years old completely avoided having a joint replacement surgery with a bone-on-bone knee. Now, stem cell therapy and PRP can also be used for tendinitis and tendinosis. I always joke around about if you have a condition that ends in itis or osis, then you have a good chance that stem cell therapy is going to help you. They can also help with stenosis. Again, there's another osis word. Narrowing the spinal canal. When we do injections into the back, we do not put them into the spinal canal itself. We put them into the muscles above the spine. They have the innate ability to hone in on the side of the inflammation and decrease that inflammation, thereby opening up the canal and making more room and that's how it's been effective for stenosis. Plantar fasciitis is another one. Okay, again, itis and osis, osteoarthritis of the spine, those bone spurs that are happening in the spine. It's not going to resolve them completely, but we have seen people make remarkable progress with osteoarthritis of the spine by injecting into the spinal muscles. It also is a big benefit for sexual rejuvenation in both men and women. Okay, we've seen it be effective for ED and for sexual issues with women as well. Now, coming soon is aesthetics. They have been shown to be effective with hair growth and wrinkle reduction. You might be thinking, yeah, where's the research? And I invite you to go to my website, iamregen.com/resources. There's research articles there. But this particular paper was an intra-articular injection of mesenchymal stem cells for the treatment of osteoarthritis of the knee. What they found when they injected these 18 patients, that it improved their function, it decreased their pain, it did not cause any adverse effects, otherwise it was safe, and it reduced their cartilage defect by increasing the amount of cartilage that they had. Papers are great. What about real life? I told you I wasn't going to share any testimonials with you, but this one I have to. Bridget's one of our favorites. She works over here at Cabela's in Idaho Falls, and her knee was a bone-on-bone knee. Again, I invite you to go to my website and see her video because the video does a lot better justice than the picture. But she wanted to avoid having a knee replacement because her brother had it and had this gigantic scar and was laid up for 6 months during recovery. She went in, got one injection, and saw a remarkable difference from that injection, continues to do well to this day. And in her video, she jokes around and says that her brother's knee has a scar this long and that she just has a Band-Aid. She was very happy with the results from doing her injection. Now, we talked about stem cells and PRP, but what about exosomes? What can they help? As I said before, because of their size, they're extremely small. They are the only thing that's cleared by the FDA to use for systemic inflammatory responses. In this picture, on the left side of your screen, you can see Anna. Anna has issues with psoriatic arthritis and with fibromyalgia, which are inflammatory systemic conditions. With IVs, Anna does very, very well. On the right side of your screen is an autoimmune disease known as psoriasis. At the top part of the picture, you can see where the immune system is attacking the knees. On the bottom part of the picture, you can see what has happened to this gentleman's knees 14 weeks after his injection, and he was certainly thrilled with the results that he got. So when it comes to what else can stem cell exosomes help with, I refer back to what are the three things that a stem cell does. Number one, they're anti-inflammatory. Number two, they control and modulate your immune system. And number three, they regenerate and regrow new tissue. So on a daily basis, I get phone calls of people asking me, can stem cells help with things like lupus, with fibromyalgia, with MS, etc. And we go back through all those three things. Is there an inflammatory component? Is there an autoimmune component? Is there a regenerative component? The answer is typically yes. That means that there is a chance that these could help you, and that is something that we do need to discuss during a consultation. Now, that takes us to the last question. Is regenerative medicine right for you? There's a few things you have to ask yourself. Number one, what is your overall health status? Because when it comes to osteoarthritis, people that are otherwise generally healthy, our success rate gets really high. And what I mean by that is otherwise generally healthy means they're still trying to be active. Their BMI, their body mass index, isn't out of control. They're only on a couple of different medications. Those are good indicators that this is going to be the right fit for you. But the more medications we add, the more disease processes that are on top of that, that decreases our chances of being successful. Again, this is why I want to consult with you, so we can just talk about those issues and find out if your overall health status fits into the scope of what we're trying to accomplish here. Number two, what's your mental mindset? If you believe this is a waste of your time and your money, then guess what? It's going to be a waste of your time and your money. And frankly, I don't know why you're still on the video with us. But if you come into this with a hopeful attitude, meaning, hey, I know that there's no guarantees in medicine, but if this works out, this could be a really, really good thing for me. If it doesn't work out, then, oh well, we tried. That type of mental mindset, we call it hopeful optimism. If that's where you're at, then there is a good chance that this is going to be a good fit for you. The third part about it is the financial part of it. Our procedures start with PRP starting at $595. And what I tell people with the financial part of this is if you can afford it, that's great, you should do it. But if you can't afford it, then certainly don't do it, because the last thing we want to do is increase your stress levels because you're out of money because you tried this new thing. Okay? Increased stress levels will lead to decreased clinical outcomes. So we want to make sure we discuss that at the consultation. Well, I'll leave with a couple last frequently asked questions. Number one, does it hurt? Hey, it is a needle. It is an injection. Our nurse practitioners are very highly trained. They do an excellent job of keeping the pain down the day of injection. I think they do a good job, but it is a needle. Okay? And typically what will happen is when people get an injection, they will be in a little bit more pain for the first 24 to 48 hours, and then they'll see that pain start to subside. And then they'll start to see change within 6 to 8 weeks of actually getting the injection. So that takes, how long does it last? How long it lasts depends on you. Hey, there are papers that suggest from this country that it will last somewhere between 5 to 7 years. There are papers from other countries that suggest 12 to 14 years. Now, if you take better care of yourself post-injection, that will increase your chances of it lasting longer. And we're here to coach you. We're here to help you understand how to do that and do everything we can to make sure it lasts as long as we can. But when it comes to answering the question, how long will it last? The answer is going to be, I don't know. It will depend on how you take care of yourself. What should I expect? Well, when we do these on an injection day, as I said, you're going to feel a little bit more pain for 24 to 48 hours. But most people will see us 6 to 8 weeks. But we've changed a couple things. And the more we've changed things, the better our outcomes have been. We're starting to see people getting better within 1 to 2 weeks. So that's the information that we've shared with you. The next that I wanted to share with you, I've answered the big questions for you. The next step is to actually schedule the consultation. Let's sit down together and let's answer your personal questions of how this applies to you. Now, act quickly because we do these consultations. They are no-charge consultations. So if you'll call our office, 208-523-1620, let's get on the schedule so we can talk and find out what your options are. Thank you.